Okay, so I'm Jonathan Hall, and I'm talking about the Unit 2 debate here. So the topic is, should doctors have to go through a social training where they learn about the history of medical malpractice, medical racism, sexism, and how it has negatively affected the marginalized populations as well as the total population of the United States? So I'm going to start by stating that I do think that doctors and nurses and PAs should have to go through this training. And I do think that it should be a recurrent training. I do not think that it should be just one time because one and done things typically go in one ear out the other, especially for a training that's required for someone to practice their job. And so if it's recurring, then it's going to be the same type of material coming in pretty often. I was thinking maybe twice a year, once every 6 months for it to be mandatory. And if the information stays current and it is consistently going into the brains of the people who are taking the training, then they're going to be more consistently cognizant of how they are treating patients and how differently their analysis of patients are. So a lot of times you see or you read about predominantly white doctors judging minorities coming in with pain and either over medicating them or not medicating them at all. And so the more specific thing that I'm going to talk about is the history of this. I'm going to go back to the antebellum period, which is the time before the Civil War. So black people were still not free. They were still slaves for the most part in the United States. So they were seen as literally a different species. So a lot of white doctors and white scientists stated that they had evolved from a different ape-like creature than white man had, and they didn't feel pain the same way as white people. Their skin was thicker, and things like that, right? So they were just generally underdeveloped, less evolved than white man, and so they couldn't think as much as white man. They couldn't feel as much as white man. And so a specific example of that, there was a surgeon who was talking to his students, and he stated that race and class should be considered when contemplating whether or not to amputate something. And so the patient at the time was a black slave, and he had a wound on his leg. So this wound wasn't anything major, but in the 1700s, it could get and 1800s, sorry. It could get infected pretty easily. So it was either try to treat the wound or amputate the leg. And he stated that since he's a black slave, the amount of pain that he's going to feel is much less than that of a white man. And so they decided to amputate it. And no one really knows what happened, but one could assume back then, if they were unwilling to treat a small wound that was going to get infected or was already infected, the chances of them being able to treat a large wound like an amputation before it got infected was very small, considering that even most white people at the time who received considerably better treatment also died from amputations due to infection. So there's that. And that happened all the time. There was another example, pretty much the same exact example, but it was a 15-year-old girl. Amputation as well. So nowadays, though, the problems are a little bit more subtle, but some of the bigger problems that you'll hear about are, black people being more prone to catching HIV or AIDS, not biologically speaking, but socially speaking, and are less prone to getting the help and attention that they need in order to treat or even prevent this disease. And then I know two people personally that had their COVID treatment delayed without notification from the doctors. So they were canceled. And then whenever one of them asked later on, the doctor said, "Oh, it was canceled for some reason. I don't know why." That was after 2 days of it being canceled. It was promised to him on the first day it was there. The third day he asked, and then they realized it was canceled. And so they started it. The other person was not as lucky. So they passed away from COVID because the treatment was denied, essentially. And they were too wary to ask due to the circumstances. And so those examples, whenever you see it from the outside, it's really glaring, it's obvious. But most of the examples of medical negligence in the United States right now, due to racial and sexual orientation disparities, is not that obvious. It's a lot more subtle for the most part. And so some of the things that you will see that are much more subtle are like doctors not spending as much time with patients of color, right? So they're not getting the time to connect with them. The patients are not willing to share as much information due to the previous negligences that have occurred in the United States, and also over medication and under medication of people of color. And this is due to them judging the people, thinking immediately if someone comes in with back pain and they're a person of color, they want medication. Like they're only there for medication. And so they either just throw medication at them or they say, "No, you don't need medication. You only have a broken back." So that's ridiculous. So then after all of that being said, I kind of wanted to talk about why it does occur. So most doctors nowadays, antebellum, it was otherwise, but most doctors nowadays are not outwardly expressive in terms of their racism or their sexism. So most of them think that they try to treat everyone equally, right? But everyone also does have their own internal judgments that lead to external actions, right? Most of them are not necessarily very aware of that. And so that's how you have these smaller, more subtle negligences occurring. But in terms of the training, right? So at health departments, right? So emergency departments, stuff like that. Most transgender content is given to them. So 85.6% of most medical communities do teach about transgender health, but 14.4% reported that they do not train about it. And then only 50% stated that it is important to train on things like transgender health. And so the reasons that a lot of these PAs, specifically PAs in this study, stated that they did not go through this training is because lack of time, right? So 50% of them said they just didn't have a lack of time. 35% stated that there was a lack of faculty knowledge and there was a barrier for teaching it. And then also 40% of them rated it as not important to learn. And so the discrepancy that we're having here, a lot of them think that since it is not the majority, that we should not learn about it. But I think that's been the common denominator throughout history, is that a lot of times we try to focus on the majority rather than the minority. And the minority is growing, right? So there's not really going to be a huge majority in the future. And so if there's ever been a time, it's been forever, but it's now. I mean, better late than never, I suppose, to start learning about it and stop being ignorant about it. And so if they underwent the trainings and it was, twice a year, once a year even, and they had to go through the class and they had to pass a test, maybe some situational questions that were asked, I do think that they would be more aware of how they're treating their patients, and they would learn different techniques to maybe learn how to better express themselves, right? And to be more accepting of other patients that are different than them. Another proposition that I have read about, though, is having a third party member there, right? So someone part of a third party that is not medically trained, but they better mesh with the patients, right? So they're able to better communicate, translate the words, because another big problem, jargon used, right? So, oh yes, you have a medial laceration on your meniscus or something like that, right? Most people, or you broke your malleolus. You have a hairline fracture on your malleolus. Like, most people are not going to understand what that means. I read about the readability is like a 14 out of 100 for some of these medical papers that they're handing out. So like the pamphlets they're handing out. Oh yes, read this. It stated that it needs, on average, someone with a PhD in that topic to be able to read it and understand it well. I don't know. Most human beings do not have PhDs, and so that is a problem. So that's something that would be trained about. But yeah, so with this third-party member, they could better translate the jargon and say, yes, so what he's saying is your ankle is hurt and he thinks it might be fractured, so he wants to get an x-ray. Stuff like that. And with a third party, according to sociology, three members in a party leads to a more stable environment and a less intimate environment. So that's going to take pressure off of the doctor as well as the patient, and it's going to add to the stability. And so that means that the patient is going to feel a little bit more apt to opening up. And over time, I do believe that along with the doctor getting training on how to deal with human beings, because that's what they deal with, I do think things could get better from there.